Hello everyone and welcome to the Safety and Compliance Center. This is Bilal Khan and here I will simplify NEBOSH IGC course for you. I'm very confident that by the end of this session you will have much better understanding of the topic if you will interact with the exercises given between the session. In this video we are going to talk about a serious but often overlooked issue in the workplace, the musculoskeletal disorders and the work-related upper limb disorders. These are common injuries that affect muscles, joints, the tendons, and often caused by the repetitive task, poor posture, or physically demanding work. We will look at high risk activities, explore the key risk factors that contribute to these conditions, and discuss why it is so important to match the workplace to individual needs. So let's start with the musculoskeletal disorders. These are the injuries affecting the muscles, joints, ligaments, and bones, the movement system of human body. A common area impacted is the back, with issues like the muscle strains, the ligament damage, and the disc injuries. Then are work-related upper limb disorders which affect the arms, the wrist, and the hands. Conditions like carpal tunnel syndrome and tenosynovitis often result from the repetitive or awkward task. Workers can also develop chronic soft tissue injuries just from staying in one position for longer period of time, whether sitting, standing, or kneeling for extended periods. These injuries may develop slowly, but their long-term effect can be very serious. Some high risk repetitive activities that often lead to the musculoskeletal disorders. One common example is prolonged use of the display screen equipment like staring at computer or working at screen all the day, which can strain the neck, the shoulder, and the back. Constant keyboard use is another major factor, especially when the posture or hand position is not ideal. In more physical settings, tasks like the factory assembly of small parts, the supermarket checkout, scanning, or even bricklaying involve repetitive motions, awkward positions, or the forceful movements that can seriously stress the muscles and the joints. These jobs may seem routine, but over the time they can lead to the chronic pain or chronic injury if proper precautions are not taken during the activities. There are several key risk factors that contribute to the musculoskeletal disorders and generally fall into three main categories: the task, the equipment, the environment. Starting with the task factors, things like repetitive movements, excessive force, awkward postures, and frequent twisting, and lack of rest breaks all put extra stress on the body. Then there are equipment related risks, especially when the tools or furniture like proper design or adjustability to suit different users. Finally, the working environment plays a big role. Poor lighting and excessive glare or even uncomfortable temperature can force workers into the strained positions or reduce their focus, increasing the chance of injuries. All of these elements combined can create a high risk setting for the musculoskeletal issues if not addressed. To help prevent the musculoskeletal disorder, it is essential to match the workplace to the individual's requirement, and that's where the ergonomic comes in. Ergonomic is all about improving the fitness of a person and their workplace. It looks at how people interact with the tools, equipment, and machineries, making sure everything is positioned and designed to reduce the strain. It also considers the workplace environment, things like space, layout, lighting, and the temperature. But it does not stop there. The organizational factors, such as the workload, the task rotation, and the break schedules, also play a big role. By focusing on the ergonomic principles, we can create a safer, more comfortable, and more efficient workplace for everyone. Let's look at a typical example working with display screen equipment like computers. This kind of work comes with several risks, including the work related upper limb disorders caused by the repetitive hand and wrist movements. Many people also experience back pain from poor posture as well as the eye strain from staring at the screen for a longer period of time. On the top of that, long hours at desk can lead to fatigue and stress, which further impact the overall health and safety and the productivity of the organization. Understanding these risks is key to making the changes that protect your well-being. Here is a quick question for you. What would you check when doing a risk assessment for the display screen equipment workstation? Drop your answers in the comment sections. I would love to interact with your answers and to keep this session interactive and learn from each other. To reduce the risk of musculoskeletal disorders, there are multiple important control measures to be followed. First, conduct a thorough workstation risk assessment to identify the issues. Make sure to provide the basic display screen equipment that meets the minimum standards like the adjustability of the chair, the proper requirement of desk. It is also crucial to plan the work routines that include the rest breaks and the task variation. Employers should offer free eyesight tests and provide glasses if needed. Finally, everyone should receive information, instruction, and training about the risk involved and how to use their workstation ergonomically to prevent the ergonomic related injuries. When using the laptops, special care is needed because laptops are not designed for a longer period of work. Ideally, laptop user should be limited to short durations only. Using a docking as station can help by allowing you to connect to a full size keyboard, mouse, and monitor, improving the posture. Remember to take the regular breaks and get eye test as needed. Other important control measures include having a good desk layout, using the document holder to keep papers at eye level, ensuring the proper workplace lighting, and using a telephone headset to avoid the awkward neck positions during calls. These small changes can make a big difference in preventing the strain and injuries. Let's do a quick group discussion. Drop your thoughts in the comment sections and let's learn from each other. Thank you very much for watching this video from the Safety and Compliance Center. If you have any question regarding this session, please drop your questions in the comment section below. I would love to answer that. This is your channel. Like it, subscribe it for more safety content. Stay safe, stay blessed, and goodbye.